No matter how capable government resources are, in times of need, in times of disaster and emergency, there's more to be done. There are more people to help than any one organization can handle alone. But we're not alone. Thanks to the efforts of volunteer organizations working with IDPH, Illinois leads in preparedness efforts and response. Here are just 4 of the many organizations that the IDPH thinks of as VIPs, or Volunteers in Preparedness.
The Medical Reserve Corps came out of 9/11 to help support communities and counties during a disaster or during an emergency. Within disaster and emergency time, or during downtime, where they can help support and educate their community on, the new and rising problems within their communities. Some of the MRC partners are your law agencies, or your law enforcement agencies, your fire departments. They help support them. Jurisdictions, as far as emergency management agency, they help support them with volunteers. We recruit IT personnel, informational technology, people with administrative assistance skills, typists, forklifts, people that know how to handle hard machinery or, top-notch machinery. We recruit college kids, the ones that, have to get those college hours, volunteer hours. Our First Lady, Michelle Obama, she has this whole Let's Get Moving campaign. The MRCs basically latched onto that and took off with it. Several of our MRCs has basically taught their community or within their in their area on activities on how to let's get moving. One of the other MRC units is now taking on this heroin epidemic that we have going on, where they have trained their law enforcement agencies on how to give the antidote, the Narcan, to heroin overdose citizens. So those are 2 of the specific ones that's kind of been going on for a while, the Let's Get Moved campaign. But this heroin epidemic, I'm just so proud of what the MRCs have done, and they've taken this on and to help educate their community on what signs and symptoms to look for within their community and how they can best serve their community on providing the antidote.
Currently in Illinois, 25% of us volunteer. But that is an amazing amount of people. That's 2 million people who volunteer in Illinois. And those 2 million people give $6.8 billion of service to communities every single year. Serve Illinois' mission is to promote an ethic of service around the state of Illinois, to get everyone to understand that they have value and they have worth and they can have an impact in their community. One of the things I love about Illinois, more so than many states that I've worked with, because I have colleagues that do this in every single state in the country, is Illinois is one community when it needs to be. In times of disaster, we have people who get in the car and drive from Metropolis up to the Wisconsin border to serve. The 2 reasons why somebody does not volunteer is they say either no one asked me to volunteer or I didn't know where to go to volunteer. So we can answer those 2 questions easily if we're already serving. We can go to a family member, a friend, a coworker and say, I go here every Friday to volunteer. Would you come with me one time? And the deal is, if you get somebody to go out and volunteer one time, they're going to come back. They're going to understand how that felt and how they were able to make an impact, and they're going to volunteer again. The ideal volunteer is anybody. Anybody who's willing to give back to the community. There's always an opportunity to serve. We have volunteer opportunities for people who want to move 50 pounds of rock. We have volunteer opportunities for people who want to fill sandbags. But we also have opportunities for people who want to work on the administrative side, help to bring in new volunteers as they're coming in, help to train up these volunteers. We also have opportunities where somebody wants to stay at home and they're good with the computer and they want to work on a website for a nonprofit. Nonprofits are looking for that. So you can be any age, you can be any ability, any background. We need you to volunteer. When a disaster happens, we are there as a resource for those communities. So depending on the disaster, we're going to have different calls of service. Some disasters happen in rural areas where there are not enough volunteers to handle the response. In that case, we work to recruit volunteers. In other areas, and when there's more of a national feel to the disaster, much like with Harrisburg tornado 4 years ago, there are too many volunteers coming. And you need some folks on the ground to work with that reception and ensure that the right volunteers are going out in the field, and those volunteers have been trained up so they don't put themselves at risks. For the Washington tornado near Peoria, we had a need for donations management. So our volunteers started up a donation warehouse and brought in over $1 million of donations and cataloged them and distributed them for 6 months. That donation management piece was going. We also work with long-term recovery. When a disaster hits, that's where the news is. That's when Anderson Cooper shows up with a microphone. But 6 months, a year, 4 years after, there's still recovery going on, and there's still needs for volunteers. I mentioned Harrisburg. Harrisburg happened 4 years ago last month. There is still long-term recovery going on in that community today. The greatest recognition a volunteer can ever get is knowing that they made an impact in somebody's life. But in order to retain the really good volunteers, we do offer quite a bit of recognition that just gives them a thank you above and beyond a kind shake of the hand. Including in there is the state has the Governor's Volunteer Service Award. It's an individual award that goes out to 30 people around the state, and we base it by region, so somebody in Chicago is not competing with somebody in Metropolis. They have awards for each group. And the nice thing about those is we break them up by category. So we have a youth volunteer, an adult volunteer, a senior volunteer, an AmeriCorps volunteer, and a Senior Corps volunteer. And then we also have the Business Leadership Awards in there as well, too, for businesses who have gone above and beyond in getting their employees to volunteer in their communities. That award is given out every year. The state also has the Governor's Hometown Award, which is given to community organizations that work with their local municipalities to build up their communities. We have companies throughout the state and throughout the country who give awards every year. Prudential has their Spirit of Service Award that's given out to youth in Illinois every year. The federal government has awards. The president has the Call to Service Award for families who serve anywhere between 100 hours all the way up to the Lifetime of Service Award, which is 4,000 hours in a lifetime. So there's quite a bit of awards out there that are available and recognition that's out there. And organizations do it all the time too. Even a recognition dinner for a volunteer or volunteers goes a long way to keeping people engaged and letting people know that they're valued.
IMERT is the Illinois Medical Emergency Response Team. We are a nonprofit organization. Our mission is to provide medical care to a community when the medical resources in that community is paralyzed or destroyed. We are activated by the Illinois Emergency Management Agency and the Illinois Department of Public Health. Our team composition is essentially made up of medical providers and allied health professionals and support members, which includes doctors, nurses, nurse practitioners, medics. Allied health include mental health providers, dentists, even respiratory therapists, dental hygienists. We also have a lot of logistical support, including individuals who are skilled at information technology, truck driving, and just maintaining our equipment and supplies. When a situation calls for a specific incident that requires medical support, we will send an initial assessment team, which will be comprised of 4 to 6 individuals within a 24-hour period. Primarily, there will be a doctor and or a nurse on that team. Once the assessment is done, we will give information and communicate back with Illinois Department of Public Health and the Illinois Emergency Management Agency. And then we'll determine with discussion with these agencies if they need longer medical provision of care. Then we're able to provide a strike team, which is comprised of about 10 to 15 individuals. And we also will bring a patient response package, which is for about 50 patients that we can provide medical care for up to a 96-hour period. One of the experiences we had recently that certainly benefited not only our team but the community we responded to is in Massac County, which is in the southern tip of Illinois. It was an explosion exercise that the community had. We also partner with not only the medical providers like the hospital, the emergency medical services, but also with the emergency management agency, the local emergency and regional emergency management agency, public safety officers like fire department and local law enforcement. We also moulage, which is a kind of makeup process that we provided for volunteers in the community to give a sense of reality to the victims they may respond to. It was a very positive and enriching exercise with all the organizations, including ourselves. What was particularly striking, shortly after that, this community did unfortunately get hit by a tornado with significant casualties and some fatalities. And we got some feedback from the law enforcement agency that because of our exercise that we participated in and shared with, they learned a lot and was able to respond in a more confident and a positive manner. With telemedicine capabilities, we can have real-time video imaging of what's going on. Number one, it will give situational awareness, not only for our team and our operations, but also for our state partnerships with state agencies, including emergency management and public health. We can give them real-time situational awareness. Another facet is also to provide direct medical communications with our providers to off-site medical providers. One of the things we're working on is with pediatric specialists. With busy pediatrician and subspecialties, a lot of the providers cannot be at a site, but we can have our providers, which is made up of mostly emergency medicine and other specialties. We can communicate with our healthcare providers.
Illinois Helps is our eServIP system. That's an organization or a system that came out of 9/11, out of the Health and Human Services office out of Washington, D.C., basically helping to support all states with a volunteer credentialing system to credential volunteers that present for a disaster and emergency within their state. What its purpose is basically, like I described, is to credential them, do a background check, verify a person's license, their medical license, their healthcare provider license, as well as DEA, which is a drug enforcement agency, and to make sure that we have credential verified volunteers to perform during a disaster. For instance, if there's a health fair in the community, or there's a marathon, which I participate in every year, the Chicago Marathon. That's not a disaster or an emergency, but that's an event that requires volunteers. So we get our volunteers involved in non-emergency commitments as well as, emergency commitments. Any organization basically that wants to utilize the system to register and maintain and track volunteers. If we ever have like a pandemic, epidemic like we did with H1N1 a couple of years ago, 2009, where we needed volunteers to help vaccinate the whole state. So what we called upon was our Medical Reserve Corps units at that time to, to vet and credential their healthcare providers, be it your registered nurses, your physicians, your physician assistants, and we even had a proclamation to utilize dentists to give vaccines during that epidemic. So that's how they support. They support public health or preparedness and response with providing volunteers to support exercises, drills, training events. I want to make mention of my partner specifically with this program, the eServIP MRC volunteer program out of IDPH. We partner with CDPH, which is Chicago Department of Public Health, on this whole program. And recently, I want to say about 4 months ago, we had a little bit of a meningitis breakout in a specific community where we needed volunteers to vaccinate the potential persons that were exposed to this. And what they did was called up their volunteers to go to bars, because this is where this group of people met, to bars, and to vaccinate them with the vaccine. And it worked out well. We called in, I want to say, 10 to 12 volunteers to go several nights throughout the week to vaccinate this population. Every year we have what we call our Public Health Summit. It's normally hosted in the northern suburbs of Illinois, and every year we ask for volunteer, recognitions, and I always come up with 1 or 2 or 3 or 4. But what I think about all my MRCs, I think they're all rock stars. So I think they all deserve something, but unfortunately we can only give 1 or 2 awards, and normally it's an award that maybe the MRC will pick out of their group, because these are volunteers that just do it out of the bottom of, out of the goodness of their heart. We have volunteers that give, several hundred hours per year just volunteering within their county, within their local health department. And I think those people do need to be recognized, and they're always recognized annually throughout their own MRC unit.
These volunteer leaders have shown us that you can find an opportunity to contribute that fits your individual situation. And wherever you can help, it will help. Join us. Be a VIP.
We envision an Illinois where everyone serves their communities, where we have 100% of everyone serving. And when we have that happen, we'll have much stronger communities. And we know through research that when a community has more volunteers, they have higher educational attainment, better economic development, and less crime. And when an individual volunteers, they live longer, they have more satisfying lives, and they're more willing to give in other ways through fraternal, charitable organizations, through their churches, synagogues, mosques, all their faith-based organizations. So that volunteering is a stepping stone to everything else that makes our communities better.